Mr. Goldberg, my name's Dr. Derek Kaczor. You're here for a report of findings.
Yep.
You initially presented to the office complaining of some low back pain. We did a family history, case history, complete health history, and it showed a family history of piriformis syndrome. After we did some more tests, we did some x-rays and everything, it showed some subluxations in the lumbar spine.
Right.
We showed a positive straight leg raiser and Lasag's test. Those are some orthopedic tests that we did that helped us confirm that piriformis syndrome. During palpation, we also felt some low back swelling and some high musculature down there. That's also indicative of a subluxation. So when we put all those together, that's what allowed us to form that diagnosis.
Right.
We also noticed upon examination that we found a left lower hip, which also would trigger some compensation, would result in some high musculature and cause some subluxations as well. The thoracic and cervical spine all looked good. Everything on x-ray and palpation and everything looked good, so we're good there. Just a little more about that subluxation. We know that when a bone gets out of place, there's nerves and nerve roots that exit at that level, and they could innervate a muscle that, you might not think that your low back pain is causing leg pain, but that could be very possible. That bone out of place impinges on that nerve, and that's going to send pain to your leg when really the problem's in your lumbar spine. So that's what we're going to address first, and we'll see how it helps with the leg pain as well that you complained of.
All right.
We found we had the stages of degeneration here, as you can see, and we found that you're only in stage 1, which is actually pretty good. You got into the office at a good time before it got too bad. So we'll go ahead and do our best to resolve that problem so we don't see any further degeneration. Once you get in the higher stages, you start to see ossification, fusion of bones, so we definitely want to make sure we stay away from that. We drew up a little care plan for you, and initially we're going to have you meet with us 3 times a week for about a month, and that's just, that piriformis syndrome and that subluxation, we don't know how long it's been there, so we're not going to see instant results right away because we're undoing years and years of that bone being out of place, so we're just going to do our best to get that bone back into place.
All right.
After that month, we're going to reevaluate you, and if we've cleared the problem up, we're going to go ahead and ramp back a little bit, and we'll only see you 1 time a week. If the problem's persisted, we'll talk again, and we'll see if we want to keep seeing you 3 times a week or what you'd like to do. Once let's say we reevaluate you a month from now and everything looks good, we'll get you started as a wellness care patient if you'd like to do so, and we'll see you once a week for 5 months, and then I'll have you in here for another reevaluation. We'll do that at least once a year. We'll reevaluate you.
Sounds good.
All right, thank you.